We're back on our show. Dr. Phillip Cole with us from Cabrini Hospital. March is Colorectal Cancer Awareness Month, and Dr. Cole with us from the Mid-Louisiana Surgical Specialist. And Dr. Cole, good to have you. Thanks for dropping by this morning.
Thank you all for having me.
And I tell you what, a busy surgeon, so thank you so much for dropping by, taking a few minutes, because the message of March is what?
That's right. What we want to educate people about this month is the importance of screening for colorectal cancer. Anyone over age 50 should be screened, and there's several different ways to do that, and that's what we want to encourage people to do.
Okay, what are those ways?
So the most common way is a colonoscopy. That's something that is done as an outpatient procedure. We look at the entire colon with a fiber optic camera, and then if we find anything abnormal, we can take biopsies, we can take out polyps, and if everything is normal, that's something that only needs to be done about once every 10 years.
Easy breezy. I mean, it actually takes about how long?
It takes about 30 minutes.
That's amazing.
Right.
I had one last year.
I've had one.
Right. We make sure that the patients are comfortable and asleep during the procedure. There shouldn't be any pain involved, and it basically just takes up some of your time.
And then you just wake up.
Right.
And then you're good to go.
Yeah.
Right. And it's an important disease because about 5% of people, about 1 in 20, will have some form of colon cancer in their life. So if everyone thinks about their family, their coworkers, their classmates, someone in that group is probably going to be affected. So.
I'm sorry, Dr. Cole, early detection is so important.
It is. Colon cancer is very common. It's the number 2 cause of cancer deaths in the country, but we do feel that it's preventable if we find it early and are able to treat it early.
Okay, there are some other ways to identify colon cancer.
Right, there are some other tests. There are some home tests where you test for blood. There's some other diagnostic tests that can be done that are a little bit less common but are available. There's even some X-ray and CT type tests that can be done. And all those different options are something you can talk about to your primary care doctor about and see what's right for you.
Obviously, you want to do the preventative, but what symptoms are going to occur if you happen to?
Right, well, that's one of the problems. There's not a whole lot of real definitive symptoms for colon cancer. The most common thing would be some bleeding, or even bleeding so little that you don't notice it, but you have some anemia or low blood counts. Right. And that's something a lot of times primary care doctors will notice.
And you're not necessarily going to lose weight. I mean, it can really go undetected for a long time.
Right, exactly. The other things that can to look out for would be a change in your bowel habits. If something changes from your normal, and especially over a long period of time, that's something you need to talk to your doctor about.
Okay. And then also we're seeing colon cancer appear in younger and younger
folks. We are. Nationwide, we're starting to see a shift and really a lot of cancer showing up in younger people. We're not sure why that is.
Yeah, I was going to ask you why that's happening, but it's still trying to figure that out, huh?
Right. Now, age is still the most impressive risk factor. So age is the biggest thing that pushes the screening. So anyone over age 50, and then if you do have a family history of colon cancer or any of those symptoms, you need to start earlier, usually at age 40.
And really, that's a conversation you need to have with your primary care physician.
That's right.
But that's something you need to ask for.
Right. Correct. You know, primary care doctors are, they're trying to manage all your different problems, everything from your blood pressure and your, diabetes and all these things, and they're very good about keeping up with your with colon cancer screening. But a lot of times you need to help them out and give them those symptoms if you're having them early on.
Is it treatable if it's found early?
It is. Especially early stage colon cancer, stage 1, stage 2, are very, very good treatment rates and survival rates. What gets harder is when people show up with a more advanced cancer. It's much harder to treat.
At what age should you have your first colonoscopy?
For normal risk person, age 50.
50?
And once every 10 years after that, if it's normal.
And that's kind of the gold standard as far as detecting colorectal cancer. It
is, because it gives us the best views of the colon, and then also at the same time, if we find something, we can take care of it.
How can we take care of our colon? What are ways?
The best thing to do, and what I tell patients, the cheapest, easiest, and safest thing to do is a high fiber diet. Fruits, vegetables, and even a fiber supplement. That's something that's easy to add to your diet, and that more than anything will help for good GI health, and it does have some preventative benefits for colon cancer as well.
And probably lots of water as well.
Right.
Terrific. Okay, I'm adding more fiber to my diet. I don't know about you, Mark.
Me too. Phillip, thanks for coming.
My
Great
pleasure.
information.
Thanks,
Good to
we
have
appreciate you.
Thanks, Mark. Thanks, Francis.
More to come. The YWCA. Stay tuned.